Hi, I'm Dr. Michelle Cespedes. I'm a doctor here at Mount Sinai, the Icahn School of Medicine at Mount Sinai here in New York City, and I am a specialist in infectious disease. Today, I've been asked to talk about COVID and BMI.
Thank you so much for joining us today. Can you tell us why is weight a risk factor for severe COVID-19?
So, despite COVID being only around for just a little over a year now, what we learned, especially here in New York, that was hit so hard last March and April, is one of the things that we take into account were, is there any way to predict, or were there any patterns that we saw with the patients who came in really quite ill with COVID-19 and the people who did well or did not do well? So one of the things that we noticed right away was that people who already had lung problems, asthma, or some reason why their lungs weren't doing as efficient a job as they should, were sometimes hardest hit. Older people, especially if they had been in nursing homes, anyone with a condition where their immune system, their body's ability to fight off viruses or infections in general did worse as well. But one of the other things that we found was that people who were overweight or had a higher BMI than recommended actually also did not fare well, or had a particularly longer course, or sometimes needed to be put on a respirator if they came into the hospital with either COVID pneumonia or difficulty breathing because of COVID-19. So not just here in New York, but around the world, we realized that obesity, or being overweight, was a risk factor for developing severe disease. And if you had bad COVID-19, also a risk factor for you needing a respirator or not surviving the hospitalization.
Can you explain to us what is BMI and what are the current vaccine eligibility guidelines?
Okay. So first, let's talk about what the definition of BMI is and why we use it. So BMI is an acronym that stands for Body Mass Index. So all of us know, even as babies, or when you take your kids to the pediatrician, or when you go to your general doctor's appointments, one of the first things that they'll do is take your blood pressure, your temperature, and more often your weight. So BMI is actually a computation that takes into account your height and your weight, so that we know that the same weight for someone who's shorter, they would actually look different or not carry it the same way for someone who's taller. So what we do is try to even that out. And once we kind of make that calculation based on their height and their weight, figure out from a scale that we've been using for years that maybe not as efficient or not as correct over time. That kind of puts where your ideal weight should be, or in terms of your health and long-term prognoses, and comparing that with, being a little bit more, or even sometimes a little bit less, rare, but we do see that, than the ideal weights, and even going on scales beyond being just overweight or over ideal weight into what we call obesity. And there's even another category, severe obesity or morbid obesity. So again, BMI is a function, a calculation that takes into account how tall you are, not just how much you weigh. It's important because there's actually a lot of data. I think even when we go to the doctor, like, oh, we just want to know how much we weigh, but it actually has a lot of implications into our long-term health. So there's a certain point where being overweight actually can impact how long you live and your quality of life, and also your risk factors for other diseases that can impact your overall health. There's an association with high BMI, so height to weight ratio, with diabetes, high blood pressure, kidney disease, and also really your immune function as well. That was actually news to me. And if you think about it, that's one of the easy, non-invasive ways that a doctor, when we're checking to see how healthy you are, those are some of the easy ways that we can actually make some changes and adjustments to actually improve your length and quality of life. Blood pressure can actually talk about your risk for stroke and how hard your heart is working, so heart disease. And weight is actually a part of that equation as well.
So if you have a high BMI, are you eligible to get the vaccine?
So as states increase their eligibility to get the vaccine based on how much they have, we really tried to target people who that we found even through the past year were more likely to get in trouble if they got COVID-19, to help protect them sooner rather than later. So the first wave, of course, were doctors and nurses and people actually even in nursing homes who were getting so hard hit, either taking care of people with COVID-19 or being exposed to them. So that was the first wave. I think that lasted here in New York. It's different state by state for about the first month or so. The next group that opened up were that people with medical conditions that were found to actually probably put them in a category to make them have bad outcomes with COVID-19. And here in New York and in most other states, we actually did include people who were obese or BMIs over 30. Some places had a little nuance or maybe even higher BMI, but BMI over 30 was actually included as the next group, a high-risk group that should get their vaccine and be protected. Also included in that group were people with kidney disease, high blood pressure, underlying conditions that lower their immune system. So that would include our kidney transplant, liver, any organ transplant, because we purposely decrease your immune system, some other systemic disorders, some other medical conditions where we give you medicines to purposely lower your immune system when your body attacks itself. HIV, even if it was well controlled, there was some data that even if you had good control of your HIV, they were more at risk for being hospitalized or having not as good of an outcome as someone with that. So indeed, because of based on what we saw and the data that we had from last year and outcomes from patients who did have COVID-19, people who have a high BMI were actually prioritized to be vaccinated right after the most immediate or the group that has the highest risk. So it was considered part of the high risk group.
Many people might not even know what their BMI is. Is this something that they can measure at home? Would they have to get this checked by their doctor? What would someone have to do to get it checked?
So actually, it's actually really quite easy to have your BMI checked if you have a scale. So I think growing up, everybody had a scale. So now sometimes even I just don't want to know the number. So I'm not sure how common it is to have a bathroom scale or a way to check your weight. But luckily, I think with the advent of technology and a lot of the formulas that we, even as doctors, use here in the hospital, if you know your weight or an approximate weight and your height, so for most adults, our height doesn't change much after our 20s, you can actually pull up, it's called a BMI calculator on the internet. I literally Google BMI calculator. I believe even the CDC or the Centers for Disease Control, who actually helped come up with some of the criteria for, the risk factors associated with BMI, and also some of the plans or the groups at highest risk for COVID as well. And you can literally plug in your height and your weight and push calculate, and it'll give you a range or usually an exact figure because it's a mathematical formula of what your BMI is. Normal BMI for most adults is about 18 to 25. So I think if I remember correctly from school, that would be about a man who's about 5'7" or 5'8" and 150 pounds or so, give or take. If you have a BMI between 25 and 30, you are considered overweight. Again, usually every 5 pounds or so for every inch in height kind of brings you up about one full BMI, if I remember correctly, give or take. Again, it's based on your height. Having a BMI above 30, a BMI from 30 to 35 is considered obese. And of course, we actually see more health problems, like I spoke about earlier, more long-term health conditions associated with obesity. If I remember correctly, I think they break up obese and severe obesity, a BMI 35 to 40, and above that, very high BMIs, high 30s, greater than 40, is considered what's called morbidly obese, which again is very severe medical consequences. But even if you're overweight, but definitely once you become obese, there's a lot of data showing poor health outcomes.
Is body weight an issue that disproportionately affects people of color? And if so, why?
So we actually have a lot of data here in the United States, actually spanning over 40 years, looking at weights over time. Sometimes, we can even divide it up down to state by state. And really, there's been a big shift since about the 1980s, since the 90s on, in how much obesity or how many people in any given state now officially meet the criteria of having a BMI over 30 has gone up dramatically in the last 30 to 40 years. What we've seen over time is that certain states, actually more states, more than half of the states in the United States actually have a large portion of their citizens overweight and obese. And unfortunately, what we do see are higher percentages of obesity in people who are not white, including people who identify as Latinx or Hispanic, and people who identified as Black or African American. Overall, the proportions are about 4 out of 10, or maybe 2 out of 5 African Americans around the country meet the criteria for being obese. The percent, so that's about 40%. The percentage for Latinx or Hispanic people here in America who meet the criteria for obesity is slightly less, but not by much, in the low 30s, about 33%. And again, non-Hispanic white Americans, about 3 in 10, so about 30% meet the criteria for being obese. So yes, there is disproportion because we see higher proportion of people in different racial categories here in the States who meet criteria to be obese. But there are a lot of things that go into those factors. Sometimes it's access to healthy foods and vegetables. Is there, healthy markets within traveling distance to where you live? Education, access to healthcare. Do you have someone kind of teaching you about nutrition, or is that supported in your community? And there are other factors that also disproportionately affect people of color here in the United States. So sometimes education and poverty, sometimes we can't really say which came first, but they tend to run together. And those also disproportionately affect people of color. I think to some extent, there's also differences in perception and what's culturally accepted that can make a difference. Sometimes, especially for women or I'm first generation, so my family's from a different country. And, what they think of as skinny is actually probably a normal BMI. Sometimes just where you live or what's, culturally normal for you can play a part into that. And that's where I think doctors can come into play as well, educating people, and not to change cultural norms, but to really talk about not just health equity, but also kind of things that have long-term effects on your health and the duration of how long you'll be here. So I think I've been paying more attention and doing a better job by speaking on that and bringing it up to patients.
Lastly, do you have any final thoughts about whether people should be vaccinated?
This is a great question. And I get asked this by not just patients, but also coworkers of mine and also family members. So one of the things some of my younger patients have been asking, even some of my younger family members have been asking, they're like, is there still COVID around? Is it that bad? And because I'm young, even if I get it, it probably shouldn't be that bad. So what I always say is that I think my perspective is different and unique because I took care of so many people who were so sick, and unfortunately some who didn't make it, that I'm skewed to think of, or maybe, be more experienced with some of the poor outcomes. So what I do is actually don't, insult people's intelligence or other things like that. But what I actually try to say is that you are right. There actually is some data that if you're younger, you might not be as sick or ever come to the hospital. But that doesn't mean that you can't get it and actually maybe spread it on to other family members. This was especially important when I was discouraging people from visiting family members around the holidays, Thanksgiving, Christmas, New Year's. And if you remember, we saw that huge spike in cases, and unfortunately, in my line of work, increase in the number of people being hospitalized and intubated and taken care of in the intensive care units. So one of the things I say is that even if we don't expect you to become very sick, as part of taking care of everyone in the community, what we need to do is have people vaccinated so that they can't likely get the virus or it won't make them sick and they won't pass it on to everyone else. The other thing I like to remind people of is that there are many, many people who, maybe felt a little ill, but weren't sick enough to come to the hospital, maybe didn't have COVID pneumonia or need extra oxygen in some of the treatments we have. But there's some other side effects or long-term effects that we're seeing now that are pretty concerning. There's evidence that just like any other virus that causes inflammation, that sometimes that inflammation is not just in the lungs, but in other parts of the body. And the things that make me nervous, especially for young people, are anything that might affect the nerves from their brain and their brain itself. Not sure if you remember, a lot of people were saying, oh, I think I had COVID. I didn't feel quite well. I wasn't that sick, but I lost my sense of smell or things tasted funny. So that's kind of evidence that there's been inflammation in the nerve that controls your ability to smell, which comes straight off the brain. There are people who have been discussing or demonstrating what we kind of call colloquially as a brain fog. Kind of forgot what I'm doing, or I came into this room and I can't quite, but for many, many more months than expected after just kind of being ill or not feeling well. So again, even if symptoms are mild, I still recommend getting vaccinated so you don't get it at all, even if you don't get sick enough to be in the hospital, to prevent any of these long-term effects that we don't know how long they last. 2, for the principle of keeping the entire community clean, I think one of the other important reasons everyone should get vaccinated is for the public health of everyone. If there are fewer targets for the virus to jump to make sick, there are fewer people who can go on to spread the disease. If enough people don't get vaccinated, that'll take longer for us to get to that point. It would also actually give the virus more time to make small changes to how its structures come together and actually cause variants that maybe the immunity that we make won't be as strong to the new emerging versions of the virus. So the quicker everyone gets vaccinated, the less likely we are to have new viruses that will be able to outsmart the immunity that we are creating with the current vaccine. And then I also say, lastly, sometimes, especially for people I know or who know me and know what I do, I say, I remember when everyone was clapping and cheering at 7 o'clock in the evening last spring when we were coming home exhausted and tired. And people would ask me what they could do for me and can we help get you food or help you? I say now, anyone who's reluctant to get the vaccine, I actually tell them 2 things. And I said, I think it's reasonable, or it's understandable why you might be nervous to take this vaccine. This is new, the virus is new, how quickly it came to be is new, and even some, I call it a trust deficit in terms of either doctors or scientists or anybody who wants to inject something in you. To those who ask me that, what I say is that even though the vaccine came to market in a relatively short period of time, what we do have is millions and millions of people who have gotten the vaccine since they've been FDA approved and available. So now we have even more information in terms of side effects, anything we should watch out for, and now even data about how well or how few new infections we are seeing in nursing homes who actually got the vaccine early, meaning that the vaccine is actually working in the sickest people, preventing them from getting sick or even coming to the hospital anymore. So now we have more data, more proof that it's even safe for you. We actually also have more data that as viruses emerge, the sooner we vaccinate everyone, the better it'll be for everyone. And your act of love for not just the community, but for me, and all the appreciation for all the time and hardship that all of us as healthcare workers and staff in the hospital put out would be to get the information you need, but to get vaccinated as soon as you're eligible.
Great. Thank you so much for joining us again.
Thank you. Thank you for offering. And I look forward to everyone getting vaccinated as soon as possible.